we have this possibility we need the importance of the not important to
आप यहाँ देखिए, यहाँ पे दिख जाएगा आपको। अगर स्क्रीन पे मैं आऊँ, यहाँ पे ऑडियो नहीं है, माइक दिखा रहा है, ये सही है। इस तरह से आपकी स्क्रीन पे जो है, आप जो बच्चे हैं उनको स्क्रीन पूरी शेयर कर सकते हो, और खुद उस स्क्रीन पे आकर यहाँ पे आकर मैं अगर उनको समझाना चाहूँ तो मैं यहाँ से पॉइंट आउट करके समझा सकता हूँ। वो इस स्ट्रीम यार्ड पे शो होगा। देखिएगा, स्क्रॉल किया तो
specific situation being studied. It also guides in the development of methodology of the research study. It determines the most of with the basis for selecting the sample and research procedures to meet the set goals. Hypotheses provide objectivity to the research activity, and it also stimulates the thinking process of the researcher, because the formulation of the research process requires exactly the thinking. What is on what basis I have to prepare the alternate hypothesis, on what basis I have to prepare the null hypothesis. So all these things require a thinking process on the part of a research to formulate the hypothesis, various types of hypotheses. There are certain characteristics of hypothesis that a good hypothesis states the causal link between independent and dependent variable, which is later evaluated by using the inferential statistics test. So there is a relationship between independent and dependent variable. Which type of relationship it is there, later on we'll be evaluating it, or we'll be proving it with the help of various types of inferential statistics test. It should correspond with the existing knowledge, what the literature is saying about that particular hypothesis which I have formulated. Because the alternate hypothesis will be depending upon what is the on what basis I'll be preparing that particular hypothesis. And the researcher must formulate only the purposeful hypothesis having relevance with the research problem and objectives of the research study. I'll be giving you one example in my latest time, then the things will be more clear. And a study may have more than one hypothesis being tested. It doesn't mean that this is my statement, this is my research hypothesis, this is my null hypothesis. It should not be. Depending upon the variables to be studied, the dependent variables to be studied, we can have more than one null hypothesis or the alternate hypothesis formulated in the research study. Each hypothesis should deal with only one relationship and one set of variables. It will be more clear from this example. This is a study on a randomized controlled trial to assess the safety of modified nasogastric tube length insertion on selected outcome variables amongst the patient with acute poison ingestion. So here we see that the independent variable is it was on the number of injection or the atropine injections used for the patients. So these were a dependent variable. So our null hypothesis was formulated for each of the outcome variable. So it was formulated as modified length of nasogastric tube will not have any safety aspiration on safety effect on aspiration in experiment group at p0.05 level of significance. Only aspiration of gastric content is not equally effective as performing the lavage at p less than 0.05. There is no any effect of modified tube length insertion on duration of respiratory support. Dose of injection atropine sulfate on OPC poisoning patients with aspiration at or lavage at p less than 0.05. So these, as per the number of outcome variables, we had to prepare as many number of null hypotheses. Okay, so the hypothesis should be testable. The researcher must be able to collect the data that can be analyzed statistically to determine if the hypothesis should be accepted or not accepted. And a good hypothesis should have a clear rationale and a clear description of the relationship between the variables of interest in the study. We have already talked about in the previous slide in the example. The hypothesis should state the nature of relationship between the variables, that whether there will be positive relationship or there will be a negative relationship. This will be discussed in the subsequent slide. Once we'll be talking about the type of hypothesis. Hypothesis should be stated in a declarative statement in the present tense, that there is a relationship, there is not a relationship, or there will be a relationship, or there may not be, will not be a relationship. Hypothesis should be very, very objective. It should facilitate the objectivity in data collection and keep the research activity free from researchers' value judgment. And hypothesis should be formulated in simple and very, very understandable terms. These are the four sources of formulating the hypothesis. It includes a theoretical framework, which is one of the very, very important and the strong source of having the idea of formulating the hypothesis, the previous research, the real life experience, and the academic literature or the previous literature. Just to give you some highlight about this, that the theoretical framework, they are the most important source of hypothesis, because in theory formulation there is a deductive approach, and these hypotheses are drawn from to test them. For example, in Pavlov's theory, a hypothesis can be drawn about the modification of the behavior of the individual. Similarly, from the previous research, you get some idea that so and so thing was, so and so particular term or the concept was used in a particular type of patients. So I have the background knowledge, background information with me, and as per the information, as per the available information, I can use that particular information in formulating the research hypothesis in the current study. So the finding of the previous research may be used for framing the hypothesis for a new study that have an area of relevance only. Similarly, academic literature, it is based on the formal theories, empirical evidences, experiences, observations, and conceptualization of the academicians or the experts. And these literatures may serve as a very good source for formulating the hypothesis for the research study. And the fourth one, talking about the real life experiences, these are the experiences which may contribute in the formulation of the hypothesis. I have some good experience of carrying out some intervention for a patient, so that would become a source for me at present to formulate my hypothesis. For example, Newton had life-changing experience of the falling of an apple and formulated the hypothesis that Earth attracts all the mass towards its center before generating a law of gravity. So it was his real life experience. Now, the types of hypothesis, primarily, there are two types of hypothesis: the research hypothesis and the statistical or the null hypothesis. The research hypothesis can be further categorized as directional or non-directional hypothesis. It can be simple or complex hypothesis, or it can be associative or the causal hypothesis. The research hypothesis, it is as such, already we have discussed that when a prediction or a hypothesized relationship is to be tested by scientific method, it is called the research hypothesis. It is a projecting statement of the relationship between an independent variable and a dependent variable. For example, we always say that there is a relationship between the lung cancer and the smoking. The relationship between the variables should be very, very clear, concise, and in understandable language. And it must have at least one independent variable and one dependent variable, and must be stated in a testable form for its proper evaluation. For example, you see that this is a complete hypothesis which has been formulated for a particular research study, that there is a significant relationship between the teaching methods and the performance score of the student at 0.05 level of significance. So what is required? There is score is the dependent variable. So we want to see the relationship between these two variables. At what level of significance? It is always taken at 0.05 level of significance. So these are the hypothesis. Directional, as the name specifies, that it doesn't only specifies that there is an expected direction of the relationship between the variable. Directional, we are going in one direction. For example, there is a positive experience between the years of teaching. And the intervention setting, where independent variable is manipulated by the researcher to examine its effect on the dependent variable. So this was about the research hypothesis. Second is the null, or this is also called the statistical hypothesis. It is denoted by H. This is denoted by H1. It is used for the statistical testing and interpretation of the statistical outcome. It states of no relationship between independent and dependent variables. That means there is no relationship between smoking and the incidence of lung cancer. Statistical hypothesis testing, we need to know about type 1 error and type 2 error. We will not be going much in the statistical part because of the lack of time, but here just from the hypothesis point of view, what is the type 1 error? It occurs if an investigator rejects a null hypothesis that is actually true in the population. So the probability of making this error is called the level of significance or alpha error, and it is considered at 0.05 level of 0.05 level. And type 2 error, it occurs if the investigator fails to reject a null hypothesis that is actually false in the population. You can see here from the example, type 1 error, saying a male person that you are pregnant, and type 2 error will be saying a pregnant woman you can see, but you are saying her that you are not pregnant. Just to, simple example to make the things clear. So in statistical hypothesis testing, a type 1 error is the rejection of the true null hypothesis. It is also known as the false positive finding or the conclusion, while a type 2 error is the non-rejection of a false null hypothesis. This is also known as false negative finding or the conclusion. And much of the statistical theory revolves around minimization of one or both these types of errors. Though the complete elimination of either, it is not statistically possible. So by selecting a low threshold cutoff value and modifying the alpha level, the quality of hypothesis can be increased. So usually this level, as already discussed, we take P less than 0.05. This is just an example of writing a hypothesis. The problem statement is assessment of the effect of breathing training program on quality of life in patients with CKD, a randomized control trial. So what is the null hypothesis here? There will be no significant effect of breathing program on quality of life in patients with CKD at 0.005 level of significance. And the alternate hypothesis is that there will be a significant effect of breathing training program on quality of life in patients with CKD at 0.05 level of significance. So this is a simple statement I have given. It is not in the directional format. So here the independent variable is the breathing training program, dependent variable is the quality of life, and the population is patients with CKD. Relationship between these two variables, what is the relationship? Predicting better quality of life among the patients performing the breathing exercises. And the level of significance is the 0.05. There are basically four phases, four steps or four phases for testing the hypothesis. Phase 1 is formulating the research hypothesis, selecting the design, and notifying the variables. Second one will be formulating the statistical hypothesis. Third one is hypothesis testing by making use of various types of inferential statistics. And then we will be deciding and interpreting the hypothesis. So phase 1, first we need to have the research hypothesis. Already we have discussed enough about the examples. Then we will be deciding on a research design based on your research problem, your hypothesis, and what you really want to be able to say about your results. For example, if you want to say that A caused B, you will need an experimental or a time series design. And if it is a probable cause is sufficient, already we are much aware about the effect of A on B, then a quasi-experimental style could be appropriate. Then we need to operationally define the variables, and one variable can have more than one operational definitions. The phase 2 will be considering or choosing the statistical procedure, that what all tests will be applied, and writing one statistical null hypothesis for each operational definition of each variable that reflects that statistical operations are to be performed. Then selecting a significance level alpha, which is 0.05 level, computing the value of the test. For example, it can be F, it can be R, it can be T, depending upon the type of data we have, whether it is normally distributed, not normally distributed. Accordingly, the test can be selected. And comparing the obtained value of the test statistics with the critical value associated with the selected significance level, or comparing the obtained p-value with the pre-selected alpha value. So test statistics, what is the calculated value? We will be comparing it with the critical value or the tabulated value. If the obtained value of the test
नहीं उन्होंने दी नहीं, वो मेरे सीट अनाउंसमेंट है ना कि शायद इंस्पेक्शन वगैरह के चक्कर में पहले दी थी फिर हटा दी।
not rejected, what is the reason behind that? And if the alternate hypothesis is accepted, what is the reason, what the literature says? So that part is discussed in the discussion section. So I'll be just giving you one example in the end, that you want to go for fishing in the lake. We do not prove the null hypothesis. And if you go for fishing for lake and you do not catch the fish, you cannot conclude that there are no fish in the lake. Okay, similarly, जब हम relationship देख रहे हैं and we see that there is no relationship, it doesn't mean that the relationship doesn't exist. Similar here is that if you're going for fishing and if you are not getting any fish, doesn't mean that the lake is not having any fish. There are a number of parameters which could be affecting that particular. That might keep us from finding fish in the lake. The possible problems may include wrong or incentive outcome, using the large net for the small fish. So the fishes we may not able to catch in the large net. Sampling problems, looking in the wrong part of the lake. We are not aware of where we have to go. Where are the fishes lying at present? They are not on the banks. They will be in the sea itself. If we are going at the wrong place, we will not be able to get the fishes. And there could be certain methodological problems. Scooping the top of the lake rather than on the bottom of the lake where the fish hang out. Similarly, if our methodology is not properly planned, things are not properly planned, these things may ultimately affect our hypothesis, whether we are rejecting the null hypothesis or we are not rejecting the null hypothesis. So just to conclude my presentation, I just want to say that research, it is very much organized exploration of a problem. The researcher attempts to gain the solution to a problem by formulating the ladder of the research process, and each step of the ladder of research process is very, very important. We just cannot skip any of the step that I am at step 1. I will be skipping step 2. Let me go at 3. Let me go at 5, and then in the end, we will not to get the good result. Formulation of the objective is very, very important. The objectives provide accurate description of the investigator to read the project. And the objectives of a research study summarize this is to be able to study. That is what will be able to do at the end of the research study. Objectives should be practice. Objectives will come up on the statement. Once the has been stated, there is a need to develop the hypothesis. And hypothesis is basically a prediction for the study, the knowledge of what could happen to a particular situation. It is this anticipation of the results. Thank you so much for
I think, ma'am, no participant is ready to ask any questions. I think their doubt are clear, ma'am.
No, sir. I think I have tried my level best.
Very good, ma'am.
Yeah.
But I'm looking at the messages in chat box.
Yes.
About the presentation.
Yes, ma'am. Everybody appreciating your presentation, ma'am.
Thank you so much. Thank you.
Thank you, ma'am.
Thank you so much. And once again, I thank all the representative of SPHERE, Dr. Samita, Dr. Sushma Sani, Dr. Atul, Dr. Shobha, and many of the people are not known to me. And from the core of my heart, thank you so much. Thank you so much.
Thank you, ma'am. Thank you, ma'am.
Hello.
Shobha? Yes. You can continue, Shobha.
Shobha, you are not audible.
Shobha? Shobha? You are able to audible? Issue, ma'am.
Some network issue. I think Samta ma'am, should we continue to next then?
Yes, ma'am.
Samta ma'am. Okay. I think if Shobha ma'am cannot, Mrs. P. Sarla.
Hello.
Hello, Mrs. P. Sarla.
Hello. Yes.
Hello. Yeah.
So,
Are you able to hear me?
yes, I can hear you. So we hand over the session to you. You can continue with the session.
Yeah. Hello. Good evening. To know in depth and just to dig to know the understanding of the phenomena, we measure what was and what is, just to know about the research design phenomena. And I'm here along with you to know something much about the research design, and let us view the speech on recordings of Ms. Nirmala Saravanan. And when we want to tell about Nirmala Saravanan, she is a multi-talented person, and she's a professor in Pondicherry University and also a senior nursing officer in Puducherry. And she's a HMR scholar, and she's doing various projects, and she's involved in organizing various projects in TB programs and communicable disease programs. And she had a remarkable program was on the communicable disease, that is the Venn diagram disease. Everything was done by her. And when we want to tell more about her, she's a national trainer in JCI India. Over to you, Nirmala.
Thank you, Sarlavs. Thank you very much for your wonderful introduction. I thank the organizers. Ma'am, can you share my slides, please? My slides are not being shared, ma'am.
Your slides are with Samta?
I am mailed to Spear. Otherwise, how should I share? I'll share it, ma'am.
Yes, you can in the left side.
Yep.
You have no slide sharing. Dr. Supal, please stop. Plus stop your slides so that we can share new slides. Dr. Supal, please stop sharing. Yes. Thank you. Still, I can find Dr. Supal is presenting. I don't know. Stop presenting. You have to click stop presenting. Supal ma'am, you have to click stop presenting.
Done.
Okay, yes, now it is okay. Yes, you can click this present now.
Yes, ma'am.
Present now, then you will get the whole screen.
Yeah, ma'am.
And you can open your slide. Have you opened your slide?
Yeah.
Then you just go, once your screen is visible, then you can just open your slide. Or you can send it to me, I can present.
Yes, ma'am. Share,
you have share your whole screen. You share whole screen.
Yes, ma'am.
Share,
yes, ma'am. Just a minute. Just
share entire screen.
share entire screen. Okay, ma'am.
It is not being shared.
It's not being shared. Ma'am, shall I mail you?
Yes, you can do that.
To Spear itself, I have mailed by 6 o'clock also, ma'am. Once again, I'll
okay, you can mail it to me. Just write Sushma, Sushma.
Yes, ma'am. Just a minute, ma'am. Sushma Compose, yes. Sorry, ma'am.
It's okay.
Compose. Yes, ma'am.
Sushma, Sushma.
Sushma.
Dr. Dr. Saini, Saini.
Saini.
At the rate Saini.
Saini, yes, ma'am. At the rate
gmail.com.
Yes, ma'am.
Okay.
Just a minute. Yes, ma'am. I've sent, ma'am. Yes, ma'am.
We have to wait for 1 minute. It will reach.
Yes, ma'am. Yes, ma'am. Shall I start by the time, ma'am?
Yes. Just 1 minute if you can wait. I'm just waiting for your slides to reach.
Yes.
Yes, it is reached. Just wait for 1 minute.
A variety of research methods to investigate one or more variables. Series and case reports. A case report, we know that a case report is studying thoroughly a report of a medical oddity where a common presentation is made of an uncommon disease or an uncommon presentation is made of a common disease. A case is studied entirely, completely and presented. A case series, it is a description of series of cases of interest. It is very popular among the clinicians and it often generates hypotheses about the possible association. Analytical studies, as we saw, it has a comparison. In analytical studies, there are, next slide, there are cross-sectional study, cohorts and the case study. Study is the one in which the picture or the outcome find in a population at a time. It is a snapshot of frequency and the characteristics of a disease in a population at a particular, where the exposure or the disease, that is the exposure or outcome, it occurs in a particular point of time. Next slide. They are very good during vulnerabilities or the risk of risk in a population. These studies are very done by all the students, all the it's a very to do study and it is very simple and inexpensive. This is the study we frequently do. The design is like this. It explains, begins with defined population. It does data on the exposure and there are four groups of possible. One is the exposed which have the disease and the other is the exposed who do not have the disease. The third group is the not exposed who have the disease and the fourth group is the one who are not exposed and who do not have the disease. Many studies are conducted with this where the exposure and the outcomes occur at a particular point of time. Next study, next slide. The both of the studies, this is how the population is selected and groups are allocated. In an experimental study, it is a randomized study and the population, the exposed and the not exposed are randomly allocated. Whereas in the observational non-experimental studies, the population is not randomly allocated to the exposed and to the not exposed. Next slide. No? A cohort study. What is a cohort study? A cohort is a group of people who share the same characteristics are called that. Next slide. No? This is an observational analytic study based upon the study. The exposure is being happened and the risk of the disease is going to be. It is to identify the etiological agents or the risk factors which produces the disease in the future. The participants who have studied the disease and the outcome or disease has occurred. Next slide, ma'am. This is how we always say that cohort study is always a prospective studies. A prospective study as well as a retrospective cohort study also can be done, and this is the design. In a prospective study, now we are in 2021, and now we are facing the panic of COVID. From now, we are assessing the patients who were affected with COVID and what are the signs and symptoms and what complications are there in the future. In 2020, again in 5 years, 10 years, and in consequent years, we assess as that we can assess from in 2000. Which sort of, like we say, the comorbidity cause of this COVID patients are more prone, like whether they is the prevention to end or and study. occurred now, and we can assess in future what applications they develop after 5 years, 10 years. The controls, whether they are exposed people, they develop a disease and they are not. Begin with from the exposure and see whether what the outcome occurs. You can study multiple outcomes in a single exposure. One single exposure has occurred, but many multiple outcomes can be studied in this sort of design. Next slide, ma'am. Now we are going into the case control study. In a case control study, the outcome has occurred, and we are going to see the exposure. When did the exposure occur? So the patient is the patient is with the disease, and we are going to see when the exposure occurred in the past. Next slide, ma'am. To start with the design, the people with the disease are taken as a cases, and the people without the disease are taken as control. Then we determine the exposure history, whether the cases were exposed or were not exposed, whether the controls were exposed or not exposed. The people with the disease are called cases, and the people without the disease are called controls. And this is how the design. The case control study begins from the outcome and moves towards the exposure. Here also, multiple exposures that can be studied from a single outcome. Next slide, ma'am. This is how the design is. Next slide, ma'am. This is a comparison between the three designs of the study. A cohort study, the exposure has occurred and the outcome is being studied. The outcome has occurred and we are going retrospectively and studying the exposure. And the cross-sectional study is the outcome and the exposure occurs at a particular point of time. Next slide, ma'am. The ecological studies, as soon as we hear the name ecology, we think that it is the study of the ecosystems, but it is a correlational study using the aggregate measures of the population. Here, not a single unit is being studied, a group of population, a group of people, individuals, or a population or a community is being studied. For example, the maternal literacy and the infant mortality ratio and the proportion of Protestants and the suicide rates, like then the experimental research design. Going into the experimental research design, the characteristics of experimental research design is there is randomization, manipulation, and control. When the three things are there, it is a true experimental design. When one concept of there is no randomization, then it becomes a quasi-experimental design, a pre-experimental design, or a time series design. A quasi-experimental design is the one which has a control group as well as a manipulation, whereas there is no randomization. A pre-experimental design is a small design. It is a design where a small set of people are being studied before big population is being studied. When the intervention is given to a small set of population, a set of people, and it has been studied. A time series is where an intervention is being given, a pre-test and a post-test is done, and a multiple time the participant is assessed, the sample is assessed multiple times, and every time it is to determine whether the dependent variable is being whether it was very effective. Next slide, ma'am. The experimental research design has three designs. It is the pre-test, post-test control group design, post-test only control group design, and the Solomon 4 design. Pre-test, post-test control group design, as a pre-test is done, intervention is given, and the post-test is done. It also has a control group. Post-test design, there is no pre-test, only the intervention is done, and the post-test is being done. There is also a control group. The Solomon 4 design, there are 4 groups like group A, B, C, and D. Group A and group B, our intervention is given for a group A, and intervention is not given for group B. And they are assessed. And then the intervention is done, and only the intervention is done and the post test is done. Whereas in group 4, the intervention is not done and the participants are assessed. This is to see there is a comparison between group A and C and a group B and D. This is to determine whether the intervention given was for internal validity as well as external validity. This sort of design is used. The problem with the Solomon 4 design is it is very costly, and it is not feasible for a student or a researcher to do it. But it gives an external as well as an external validity for this is the best sort of the experimental research design. Next slide, ma'am. Next. Going into the qualitative research designs, why do we do a qualitative research? Qualitative research starts with there is no hypothesis. We are not going to test any hypothesis. We are going to form a new theory. From new theory is going to be formed. So qualitative research designs, there are many types: grounded theory, ethnography, field research designs, phenomenology, and case studies. In grounded theory, it starts from the bottom up of process.
Hello, is the connection is lost? Hello?
Yes,
Hello?
ma'am, I think.
Can you reconnect?
Hello, Nirmala ma'am.
Hello? Is the connection is lost? Actually, I don't have her phone number. If somebody can phone her and
Madam Sarla can contact with her. Sushma ma'am.
ma'am, I will contact her, ma'am. I will contact her.
I'm audible, ma'am. Am I audible,
Yes,
ma'am?
ma'am.
Yeah, you're audible.
Yeah. Okay, ma'am. Qualitative research. Qualitative research. It doesn't have a hypothesis. We are not testing the hypothesis. Whereas a new theory is being formed by the researcher. The grounded theory, it is an inductive process. It starts from the bottom up, and we are generating a new theory. Whereas ethnography, it is the study of the society or the culture. It is observation of everyday life, and from there we form a new theory. Field research is directly going into the field, observing what happens in the field, and then forming a new phenomena. Phenomenology is subjective experiences of the participants are observed and interpretations are made. And case study, it is a descriptive, exploratory analysis of a single case. The whole case is studied and the complete phenomena is studied and it is presented. Next slide, ma'am. What do we do in a qualitative research? As I told, we do not test any hypothesis or previous theories. We do not try to generalize any findings, and we do not know or try to develop the response categories prior to conducting the study. A new theory is formed or a new concept is generated. Next slide, ma'am. Next slide, ma'am. What are the characteristics of a qualitative research design? It does not begin from. It never begins from a predetermined starting point. There is no steps or anything, but it involves the interconnection and interaction among the different design components. Going into the field, we develop our designs and we design our tool. Next, previous, ma'am. Next, ma'am. These are the qualitative research designs. For grounded theory, we use an historical design. For ethnography, we use action research. For phenomenology, we use content analysis, and for field research, we use a generic qualitative case study, and it is a case study methods, or also a whole case study is completely studied. Next slide, ma'am. Next slide, ma'am. Randomized control trials. Going into the randomized control trials. Ma'am, previous slide, ma'am. The randomized control style, the study population are randomly assigned. A current treatment modality is given, and a current treatment modality is given, and they see whether it improves or not improve, and a new treatment modality is given and seen whether it improves or do not improve. This is what was done in our COVID vaccines. The population was randomly assigned, and the study was conducted, and these are used for a new treatment modality, and this decides whether the treatment is effective or not, whether it can be used or not. Next slide, ma'am. This is the hierarchy of research designs. As we saw, ideas, opinions, editorials, anecdotals, these are the basic designs, designs where lies in the basic. Next comes the case series and case reports. The higher hierarchy goes to the cross-sectional studies, then the case control studies, the cohort studies, and the RCTs. The topmost is the systematic review or the meta-analysis. Systematic review is reviewing all the research studies previously done on a particular topic, and meta-analysis also a complete revision of all the studies which were done previously, and completing the research. Next slide. Any questions, ma'am?
Sarla, before the participant starts, may I ask you one thing? I have a little doubt on the present slide which I am just presenting, because this historical research is an independent. It's not the grounded research which is done in the form of historical research. The grounded research is different and historical is different. Similarly, ethnography and action research is also different. And this phenomenological study as content analysis is being done. But I think these are different type of studies and not the similar. The all different type of studies.
Oh yeah, ma'am. These are all qualitative research designs. Grounded theory, yes, ma'am. As ma'am, previous slides and previous slide, ma'am. Before slide, ma'am. Before, yeah, ma'am. Grounded theory, as you said, it is a bottom-up process of generating a new theory from the data. And ethnography, as you said, is it emphasizes on the real world, like a study of the culture, study of the society, and those are all action-based research is also a qualitative research design. Yeah, ma'am, I simultaneously, yes, ma'am. Grounded historical research is we study from the research and we form study from the previous researchers, and it is also a qualitative, yes, ma'am. Qualitative research design is also that, sorry, ma'am. Yes, ma'am.
Now, yeah, thank you, Nirmala Saravanan, for your incredible presentation.
Yes.
Your presentation on research design provided answer to various queries. And any queries to discuss right now?
The commonly done research, what we do is the explorative research, the cross-sectional studies, the descriptive studies, and now we are nursing is encouraging us to do many experimental research designs, which is considered as the topmost priority design. Any queries, ma'am? Actually, the time was given as 30 minutes, so as much as possible things I put together compiled it and tried to present it. Actually, there were each subject, one is a 30 minutes, 45 minutes thing. So I thought of putting it everything together and completing it by 30 minutes. Any doubts are there?
Yeah, wonderful presentation. Any inquiries?
I hope the presentation was in nutshell very good. So I hope the participants is not having any queries. You explained very well every type of research. So thank you, Nirmala. Sarla, over to you.
Thank you, ma'am. Thank you, Nirmala. It was really very good presentation and very wonderful. And thank the SPEAR team for this opportunity. And it is really a mind-blowing presentation. That is was from my part. Thank you.
Yes, getting the messages in the chat box also.
Yeah, yeah, you are right, ma'am.
Over to you, Shobha.
Okay, thank you so much, ma'am. Thank you, Sushma, ma'am.
Participants, tomorrow we have another session for this webinar. So I request Shobha to say, tell the participants about the tomorrow session.
Yes. Tomorrow we are having third session of webinar. So tomorrow the topic is that population sampling and sampling technique, sampling size, calculation, and how to take the check the sampling errors. So session will be taken by resource person is there Dr. Sushma and Dr. Kanchan Pala. They will be a resource person. And thank you so much. Today's session is a very interactive session. What we can say, informative session. Dr. Mamta, Dr. Nirmala, and Dr. Sukhpal, madam, they both presented very well their session. And especially today's topic is very important for the master's students because many times they are having doubt regarding the how to prepare the hypothesis. Research design and the introduction about the qualitative and quantitative. So today's topic is very clear to all. I hope so. Thank you so much. So we will meet again tomorrow. And special thank to Dr. Sushma Saini because many times I lost my internet, but she managed. And Dr. Sushma, ma'am also, Soni ma'am also. When I lost my internet connection, they cope up. Thank you so much, ma'am.
Thank you, Shobha. I request all the participants please join at the time because this is not good. We are waiting and our experts are waiting for you to join and the session has been late. So kindly join tomorrow at the time sharp at 5:45. So we can start the session and eminent personalities who are
with us
time for the SPEAR, they will not have a waiting period for you. So kindly join a time sharp at 5:45. Over to you, Shobha.
Yes. And dear participants, I have one more important request to all. Please ask the questions. Please clear your doubts because this is very, every important resource person giving us their special and precious time with us. So better we can ask, we can clear time. Okay, so this is my request. Please ask questions. Please clear your doubt because when you will going to ask the question, it means active participation with the both sides. Thank you so much.
Come prepared.
Thank you,
with the questions. You can think of your question and come prepared with the question. Then only you will be asked.
Yes, ma'am. Yeah, so, definitely.
Tomorrow's topic, again, I'm repeating that Shobha's population sampling and sampling techniques will be taken by Dr. Sushma Saini and the sample size calculation and sampling error. So kindly be prepared, come with questions, ask the experts and refine your research. So thank you so much
Good night, ma'am. Thank you,
ma'am.
Nirmala, Sarla, Atul, Shobha, and Dr. Sukhpal. Thank you so much, and especially thank you, Dr. Meenakshi Vyas, who is taking care of the technical team, and we are on YouTube with this link. So I request Dr. Meenakshi Vyas to share the link with the all partners.
Thank you,
They
ma'am.
can
Thank you, ma'am.
watch later. And we are on YouTube, and we are having live YouTube the telecast with the help of Dr. Meenakshi Vyas.
Thank you,
So
ma'am.
you can visit sessions on YouTube afterwards. So Dr. Vyas, please share the link on the chat box so the participants can visit
Ma'am, I
again.
already
on YouTube.
shared in chat box before.
Okay.
Okay. Thank you, ma'am.
Yes, ma'am. I saw. Sabta, ma'am.
Yes, Shobha.
Give special thanks to Sushma, ma'am, because when we have problem, she's able to manage.
She
Okay,
is
thank you,
all-rounder, she is all-rounder in his sphere. And sphere is all-rounding of Dr. Sushma Sani.
And it's not there. It's a participation
हम
of
आपके साथ
everyone.
घूमते रहते हैं मैडम, आपके चारों तरफ घूमते रहते हैं.
Yes, ma'am. इनसे मेरा मुलाकात हुआ है एक बार. जी, thank you, ma'am.
Thank you so much. Thank you all participants. See you tomorrow at 5:45. Please be on time.
Yes,
thank you so much. Thank you, Atul.
Thank you, ma'am.
Thank you, Atul.
Thank you, Sushma. Thank you.
Good night.
Thank you, ma'am. Good night. Okay, good night.
Thank you. Good night, ma'am.